Multiple sclerosis (MS) is a neurological disease. Look at this picture, shows that myelin sheath, MRI findings. Look at this detail going on. Introduction. Multiple sclerosis is a chronic autoimmune disease that affects the central nervous system, which includes the brain and spinal cord. It is characterized by the immune system attacking the protective covering of nerves called myelin. Leading to communication problem between the brain and the rest of the body. MS can cause a wide range of symptoms including physical, mental and sometimes psychiatric problems, and its severity can vary greatly from one person to another. Definition. Multiple sclerosis is defined as a chronic inflammatory demyelinating disease of the central nervous system. It involves the progressive destruction of myelin, the fatty substance that insulate nerve fibers, leading to impaired nerve condition and consequently a wide array of neurological symptoms. Types. There are four main types of MS. 1. Relapsing remitting MS. The most common form characterized by episodes of new worsening symptoms followed by periods of partial or complete recovery. 2. Secondary progressive MS. Initially this type begins as PRMS, but over time the disease progresses steadily without relapses or with fewer lapses. Disability gradually increases. 3. Primary progressive MS. A less common form characterized by a steady progression of symptoms from the onset, without early lapses or remission. 4. Progressive relapsing MS. A rare form where patients experience a steady worsening of the disease from the beginning, but with superimposed relapse. Causes. Exact cause of MS is unknown, but it is believed to result from combination of genetic predisposition and environmental factors. Theories include 1. Autoimmune response. The immune system mistakenly attacks the myelin sheath. 2. Genetics. A family history of MS may increase the risk. 3. Infections. Certain virus such as Epstein-Barr virus have been linked to the development of MS. 4. Environmental factors. Low vitamin D levels, smoking, and geographical location more common in regions further from the equator are considered risk factors. Risk factors. 1. Age. Most commonly diagnosed between age 20 to 40. 2. Gender. Women are about twice as likely as men to develop MS. 3. Family history. Having a parent or sibling with MS increases the risk. 4. Infections. Certain viral infection like Epstein-Barr may trigger MS. 5. Climate. MS is more common in temperate climates. 6. Vitamin D. Low levels of vitamin D and low exposure to sunlight are associated with a high risk. 7. Smoking. Smoking increases the risk of developing MS and can worsen the disease. Complications. 1. Physical disability. Progressive muscle weakness and coordination issues can lead to significant physical disability. 2. Cognitive impairment, memory, concentration, and problem solving ability may be affected. 3. Mood disorders, depression, anxiety, and mood swing are common. 4. Bladder and bowel problems. Constipation can occur. 5. Sexual dysfunction, reduced libido and erectile dysfunction may be experienced. 6. Fatigue, a common and often debilitating symptom. 7. Pain, neuropathic pain such as trigeminal neuralgia can occur. Pathophysiology. The pathophysiology of multiple sclerosis involves a complex and multifactored process in which the immune system mistakenly attacks the central nervous system, leading to the inflammation, demyelination, and neurodegeneration. Here is step-by-step breakdown of the pathophysiology process in MS. 1. Genetic and environmental susceptibility, genetic predisposition, environmental triggers to immune system activation, antigen presentation, T cell activation. 3. Breach of the blood to brain barrier, BB disruption. For CNS infiltration and immunoattack, CNS inversion, myelin destruction, cytokine release. 5. Formation of MS lesions, blocks, demyelination, oligodendrocyte damage, axonal damage. 6. Neurodegeneration, chronic inflammation, glial scarring, brain atrophy. 7. Disruption, neurological communication, impaired signal transmission, relapse and remissions. 8. Progression of the disease, secondary progressive MS, primary progressive MS. 9. Clinical manifestation, motor symptoms, sensory symptoms, numbness, tingling, pain, sensory loss. Visual symptoms, optic neuritis, blurred vision and diplopia. Cognitive symptoms, memory loss, attention deficit and executive dysfunction. Fatigue, a common and often debilitating symptom in MS patients. 10. Chronic neuroinflammation, sustained inflammatory environment. The pathophysiology of MS is a complex interplay between genetic susceptibility and environmental triggers, immune system dysregulation and neurodegeneration. The disease progresses through stages of immunomediated demyelination, axon damage and neurodegeneration, leading to the diverse and often disabling clinical manifestations of MS. Understanding this process is crucial for developing targeted therapies aimed at modulating the immune response, protecting neurons, and promoting repair mechanisms in the CNS. Signs and symptoms. The symptoms of MS vary widely depending on the location and extent of CNS damage. 1. Motor symptoms, weakness, spasticity, tremors, and coordination problem. 2. Sensory symptoms, numbness, tingling, and pain. 3. Visual symptoms, blurring vision, double vision, and optic neuritis. 4. Cognitive symptoms, memory loss, attention deficits, and difficulty with executive function. 5. Fatigue, a common and persistent symptom. 6. Bladder and bowel dysfunctions, urgency, frequency, inconsistence, and constipation. 7. Emotional changes, depression, mood swing, and irritability. 8. Dizziness and vertigo, balance problems, and feeling off balance. Diagnosis. The diagnosis of MS may be challenging due to the variability of symptoms. The following tools and tests are commonly used. 1. Medical history and neurological examinations. A thorough history and physical examination to assess symptoms and rule out other conditions. 2. Magnetic resonance imaging (MRI), the most important imaging tool for detecting MS lesion in the CNS. 3. Lumbar punctures, spinal tap, analysis of CSF, cerebrospinal fluid, can reveal abnormalities typical of MS, such as oligoclonal bands. For evoked potentials, test that measure the electrical activity in the brain in response to stimuli, revolving delays caused by demyelination. 5. Blood test to rule out other conditions with similar symptoms. Nursing diagnosis. Nursing diagnosis for patients with MS may include 1. Impaired physical mobility related to muscle weakness, spasticity, and fatigue. 2. Self-care defect related to physical limitations. 3. Chronic pain related to neuropathy or muscle spasticity. 4. Disturbed sensory perceptions related to altered nerve conduction. 5. Risk for impaired skin integrity related to immobility. 6. Impaired urinary eliminations related to neurogenic bladder. 7. Ineffective coping related to the chronic nature of disease. 8. Risk for falls related to muscle weakness and balance issues. Management and treatment. There is no cure for MS, but various treatments can help manage symptoms and slow disease progression. 1. Disease modifying therapies (DMT). Medications that reduce the frequency and severity of relapse and slow progression. Example: interferon beta, clitomer acetate, natalizumab. 2. Corticosteroids used to reduce inflammation during acute relapse. 3. Symptoms management, medications and therapies to address specific symptoms, such as muscle relaxants for spasticity, anti-spasmodities, pain relievers, and antidepressants. 4. Physical therapy, exercise to maintain mobility, strength and balance. 5. Occupational therapy, assistance with activity of daily living and the use of adaptive devices. 6. Speech therapy, to help with speech and swallowing difficulties. 7. Psychosocial support, counseling, support group, and mental health services to address emotional and psychological aspect. 8. Lifestyle modifications, diet, exercise, and stress management. Psychosocial medicine, living with MS can be emotionally and psychologically challenging. Patients may experience depression, anxiety, and social isolation. Psychosocial intervention include 1. Counseling and psychotherapy. Cognitive behavioral therapy can help patients cope with the emotional impact of MS. 2. Support groups, providing a community of individuals who understand the challenges of living with MS. 4. Education, empowering patients with knowledge about their condition and treatment options. 4. Stress management, techniques such as mindfulness, relaxation exercises, and yoga. Prevention, while MS cannot be prevented, certain strategies may reduce the risk or delay the onset of symptoms. 1. Healthy lifestyle. Regular exercise, a balanced diet, and avoiding smoking. 2. Vitamin D supplements, ensuring adequate levels of vitamin D, especially in regions with low sunlight exposure. 3. Early detection, recognizing early symptoms and seeking prompt medical attention can help manage disease more effectively. In conclusion, multiple sclerosis is a complex and unpredictable disease that affects each person differently. While there is no cure, advances in treatment and management have significantly improved the quality of life for many patients. A multidisciplinary approach, including medical treatment, physical and occupational therapy, and psychosocial support, is essential in helping individuals with MS lead fulfilling lives. Ongoing research continues to seek better understanding and more effective therapies for this challenging condition. Thank you. Have a good day.